extraordinary news that this morning Britain is now officially out of the pandemic. So it was the 11th of March, 2020, we officially went into the pandemic, and now a leading Oxford scientist has said, having looked at the data, having gone through it all, because of the fall in infection rates, we're now out of the pandemic. So, Dr. Amir Khan, I mean, it sounds like, and it's covered in several of the papers, the news we've been waiting for.
Morning. Yeah, it's a very bold statement from a lady called Professor Sarah Walker, who's the chief investigator of this study that has been in all the papers, as you say.
Yeah.
And what they've done is take 1.6 million swabs from people across the UK over the last few months and compared those swabs from people who've been vaccinated to people who haven't been vaccinated or yet to be vaccinated. And what it shows is that even having one dose of the vaccine reduces your risk of having the virus getting symptoms. It can reduce your risk of symptomatic infection by 74%, but importantly, it can reduce your risk of having no symptoms and carrying the virus by over 50%. So these people would otherwise be wandering around, perhaps spreading it around, but the vaccines reduce that risk. What it also showed, which is really interesting, is that the people who did test positive for the virus, who had had the vaccine, had much lower viral load. So again, less risk of transmission. So that is what she's referring to, that we are hopefully turning the tide on the virus and reducing this rate of transmission.
I suppose, though, when you look at her bold words, Britain has moved from a pandemic to an endemic situation. It's going to make people think, oh, thank God, is this VE day? Is it all over?
I wish I could say yes to that. I think we have to be cautious, and I think she does go on to caveat that statement with caution, because we've seen in Brazil and India and now Canada what happens when you perhaps lift restrictions too quickly or don't put restrictions in at all. And so even though we're doing really well with this vaccination programme and the evidence is really good in bringing numbers down, lots of people I wouldn't say just yet we're perhaps out of the pandemic, but it is really good news.
Yeah, and as you say, the vaccine is the key. I had my vaccine last week, actually, and I had the AstraZeneca one, and everybody kept saying, "Are you feeling ill? Are you feeling okay?" And I actually
I think we've got pictures of Sean. Look, we need to show pictures of Sean having the vaccine. It's traditional.
Not that special.
When you get your vaccine,
I mean, they're nervous.
Looking a little bit worried there.
Well, I felt okay, and everybody kept saying, "Well, you know, you're going to feel ill. It's going to be difficult." Actually, I didn't. But the more people who asked me, the more I felt a little bit queasy. But I didn't actually feel the prick of the injection. It was actually very straightforward.
Yeah.
Knowing what you're telling us now, the fact that it makes us feel, like it's taken us out of this pandemic, as we say. Some people saying out of a pandemic completely. It is brilliant, isn't it, to hear that? And then you see inside the Times as well, COVID overtaken as the main cause of death for the first time since autumn. So I think dementia and heart disease are above it. This is the sort of news we wanted to hear this time last year, wasn't it?
It is. It's really good news. It shows how effective the vaccines are. And it's not just the vaccines, it's the restrictions that we've all been living with and the social distancing measures as well.
Yes, because Boris Johnson was pretty clear last week, wasn't he? He seemingly in contradiction to this, he's saying, let's be clear about it, lockdowns, not the vaccinations, are responsible for those numbers falling. But this seems to show, actually, we can lift that lockdown a little bit. You can see people immediately asking for it.
You can see people immediately asking for it. Again, I would exercise caution. It's a combination of the lockdown and the vaccine that's helped us get to this position. But it is good news that COVID is no longer the leading cause of death in the UK, and it means that the NHS can help, focus on other conditions as well.
Yeah, I want to sort of touch on some of the things that lockdown hasn't helped with, and one of the things that I really feel passionate about is mental illness. I mean, we heard really sad news yesterday. Trevor Phillips, the former chairman of the Equality and Human Rights Commission, his daughter, Sheila, died after a 22-year struggle with anorexia. That comes straight after Nikki Graham of Big Brother fame died aged 38 after struggling with eating disorders. I mean, these are two high-profile cases. There are many more, and mental illness is growing very quickly. Is that the new pandemic that we are going to be facing?
Well, it may well be. We're seeing a surge in cases of people with mental health conditions. Certainly anxiety, loneliness, depression have all been exacerbated by lockdown measures, and we can't shy away from that fact. And I think as things ease, people may well come forward in talking about it. We're already seeing that in our surgeries. eating disorders in particular, people may well use, may turn to kind of disordered eating because they're stressed and not coping with things like lockdown. I know Nikki Graham's mum suggested that Nikki was floored by lockdown, and certainly stressful situations can make those symptoms worse. So I do think we are going to be hit by a wave of people who have mental health conditions. The question is, does the NHS have the services to cope with that wave? And in my experience, that isn't the case. Mental health services are woefully lacking across the country and need a lot more investment.
And that's my big passion. I mean, I made a programme about that, how the services are completely overstretched. The people who work in those services are heroes, but they are overstretched, overworked and underfunded. And our thoughts, of course, go to Trevor Phillips' family and Nikki Graham's family. One thing that really struck me was Trevor Phillips' other daughter, Holiday, posted on Facebook, she was one of the wisest, kindest, strongest, funniest people I know. And that's the thing with mental illness. You could be the best-looking person, the cleverest person, but you know, we could see people who are like that, but we don't know what's going on in their mind, and mental illness just floors you if you have it.
Absolutely. It can affect any one of us. Eating disorders in particular are really common. 1.6 million plus people suffer from them across the country. 1 in 4 of those people are male, so it's important to break that stereotype that they are females as in the majority of cases. So I think, yes, you're absolutely right. You know, you don't know what's going on with someone on the inside, and we certainly get patients come in from all walks of life who are suffering from different types of mental health conditions.
And I know it's something that you've had challenges with within your family as well, haven't you?
Yeah, very much so. So my son has OCD, and that was the situation. I don't want to go on about my situation too much, but we found that we waited 9 months to get care, to get the right level of care for our son. I mean, I mean, if he had broken his leg and you waited 9 months, that'd be headline news, wouldn't it? But it was sort of, that's just what happened.
We do need to get to a point, don't we, where we can view mental, ill health in the same way that we fortunately most of the time can tackle physical ill health. One of the other statistics to come out of lockdown is that drinking has gone up. Richard Arnold, I can see out of the corner of my eye nodding furiously. But smoking's gone down.
Yes.
What more people have, about, lots of people have managed to quit smoking in lockdown.
Yeah, so we are seeing, half of the people surveyed suggested that their drinking habits had increased during lockdown. And again, that goes down to anxiety, loneliness, depression, that people turn to alcohol as a coping mechanism. Of course, it doesn't work. It's a depressant in itself. But the smoking statistic was really interesting, that numbers have come down. And it's not clear why. It may be because people are spending more time at home with their families, children, so may not want to smoke around them. But it may be that we're aware of the air we're breathing because of coronavirus particles, that kind of thing.
And protecting our lungs and all the worries about acute respiratory failure.
Absolutely. Whatever the reason, it's a good thing,